Hello and happy Tuesday, my chiropractic family and friends. This is Dr. Dave Yachter reporting live from the Yachter Family Studios. And I have a message for you this morning on a couple of important topics. First, I want to give thanks and a praise report for one of the testimonials that a patient of mine, Roger, shared with me a few days ago. And we were reviewing his progress films after he had a really bad accident a few weeks ago. And he came in with his upper back hurting. And, that went away in a very short period of time. But as he turned to me after I gave him his report of his x-ray showing nice improvement, he said, I have to tell you that recently I've noticed how much more clear my thinking is, how much faster my recall is, and I just feel more sharp, more lucid. And he's like, really, the only thing I've been doing different here the last 4 weeks is getting adjusted. It's this. That's all I can attribute it to. And I said, well, that makes a lot of sense because, every time you come in and you're on your back, I have that little temperature reading gauge that I look at the right side here and the left side, and I'm measuring something called your atlas. And that's the area which is right on the brainstem, which regulates your blood pressure, your breathing, your immune system, your sleep, your balance, your feeling of well-being, and really also the flow of all the cerebrospinal fluid, which bathes your brain, and every firing neuron in your brain depends on, and also all of the portions of the spinal cord that depend on it as well. And it opens up and takes pressure off all that, increasing the flow from the brain down the spinal cord. And so right now, based on what the x-rays are showing, there's massive improvement there. So we're giving thanks for that. And as I always say, the best is yet to come. But that Atlas adjustment is hugely important because, Roger didn't really have any high blood pressure. He didn't have any vertigo. He didn't have, many of the other health problems and symptoms that people who come in with a subluxation of that area exhibit. But I would venture to say, normally what we're doing is when we're finding that area and a problem and we're fixing it, we're preventing a lot of these problems, such as high blood pressure, such as vertigo, such as weak immune system, and a lot of these other health problems, which who knows when would have manifested itself, but we eliminated the cause of it before it had a chance to develop. And so that's powerful. And that's what I love about chiropractic and being a chiropractor. And I just wanted to share that passion with you this morning. And I'm excited about testimonials that we get from that. When you guys share that on Google with the reviews and other people read about stories like yours, they become inspired. Lay people out in the public, they become inspired, they become encouraged. And then they may make a good decision to try chiropractic instead of having surgery or more drugs or injections, which usually wind up harming them more in the end. So I want to thank you for that. I want to thank you for helping me on my mission to make our community a healthier place. And that's how we do it, one spine at a time. So really this morning also, I want to bring our attention to heart health because September is Heart Health Awareness Month. And looking into some of the details with this, I wanted to share with you mitigating the risks of cardiovascular disease and death, which is a very real factor. Statistics show today by 2030, the year 2030, more than 40% of the population just in the United States is projected to have some form of cardiovascular disease, which is, inclusive of coronary heart disease, stroke, heart failure, heart attacks. So here's some fun facts. Most heart attacks hit during the early morning hours, usually between 4 and 10 a.m. Did you know that? That's because the blood platelets are a little bit stickier during that time. And there's also an increased spike of adrenaline, usually with most people running high cortisol levels first thing in the morning, with the stress of the day. It usually triggers a rupture if there are plaques in the coronary arteries. That's the most likely time that's going to happen. Other risk factors significantly jump on Mondays. Doesn't surprise you or me, does it? And also, here's another fact that the most number of heart attacks in any calendar year occurs on one particular day. Guess what day that is? Can you guess what day that is? Most of you are you saying Christmas? Very good. Yes, that's it. Christmas. Sad. It's the happiest day of the year, but for many, it's the saddest day of the year. Nonetheless, a good 80% of this is preventable, and the risk factors are controllable. There are behavioral factors and there are metabolic factors. With the behavioral factors, we know this. It comes down to physical activity and exercise, and not getting enough of that. Maybe too much salt in our diet, too much alcohol in our diet, too much smoking, these days vaping. So behavioral factors are a significant contributing factor, which are definitely controllable and reversible. And then you also have metabolic factors, which are also reversible as well. High blood pressure, high blood sugar, high body mass index, your BMI. Here's a big one: low levels of HDL. And if you go on the internet and you search this out, they're going to tell you the highest risk factor when it comes to heart disease, or one of the highest, is low LDL. And you know what? I want you to understand, and you will if you come to this workshop, you're going to understand why low LDL, eliminating that risk, does not eliminate your risk of a heart attack. Just as many people have heart attacks with low LDL as with high LDL. So LDL is not the factor. The bigger factor is low levels of HDL. If you have low levels of the good cholesterol, that affects your total cholesterol ratio. And that's a big factor. So come to the workshop so I can explain this to you in more detail. You have a better understanding how to control your cholesterol the right way, instead of using drugs and not eliminating your risk, even though you're taking the drugs and facing harmful side effects as well. So about 116 million United States adults, that's nearly 1 out of 2, have it. And high blood pressure is very common. It's so common that we just think it's normal. I remember going to my high school reunion a few years back, and I'm looking at all my 49-year-old friends, and half of them are on blood pressure medication and cholesterol medication. And then the other half were diabetic. So again, we ask ourselves, is this normal, or is this just common? Just because it's common, it doesn't mean it's normal. Huge significant factor for heart disease. As I said, low cholesterol ratio needs to be understood now, coming into fine focus, because this can literally double a person's risk of heart disease. So remember, conventionally, most of us have been told that it's the low LDL that's dangerous. And what newer studies are showing is that's simply not true. It's the cholesterol ratio that's the greater predictor for disease. And we're going to address this at the workshop. How do you understand your cholesterol ratio? So when your doctor is going over your blood test results with you, and they say, I don't like this, I don't like this, you need to get on a statin, you need to take this drug, that drug. How do you read through all that and navigate as an educated person who can have an intelligent discussion with your doctor and protect yourself? Because what the new studies and the science is showing is that you have to go about this a different way to make a better decision to get better results. And your medical doctors may not be reading their own journals. They may not be up to date with that. And if you're just blindly trusting their opinion or based on old junk science, you lose. And I don't want to see that happen to you. So again, this is what we're going to break down at the workshop. Just as many people have heart attacks with low LDL as with high LDL. So just taking a statin or even supplements to try to lower your cholesterol or lower your LDL in and of itself is not a risk reduction strategy. Does that make sense? So also diabetes, that's a huge factor for heart disease. You're twice as likely to have heart disease or a stroke if you have diabetes than somebody who doesn't. Over time, it destroys the blood vessels, not just to your heart, but also to your brain, leading to things like dementia and Alzheimer's and stroke. And we all know the effects of the long-term problems that come with that. Smoking, we all know, is a major cause of heart disease. Why? It raises your triglycerides. It lowers your HDL, the important healthy cholesterol. It damages cells in your blood vessels. It causes thickening and narrowing of the blood vessels. And we know that. I don't know that many of you are watching this right now are actually smoking. Most people don't, but 1 in 4 people still do. It's a sad statistic, globally speaking. In the United States, nearly 74% of adults are overweight or obese. If you didn't know that, compared to those at normal weight, These people are at much greater risk of heart disease and stroke. We know this. It includes contributing to the risk of high blood pressure, cholesterol, triglycerides, and also type 2 diabetes. So being overweight or obese, we know is a significant factor. And again, controllable behavioral and metabolic factors go into this, completely reversible. And so that's why I'm excited about the workshop, so we can give you the steps and the strategies to help peel back the layers on that one factor. And then physical inactivity, we also know that this leads to heart disease. Crazy thing, only 24% of adults, statistics show, and 16.5% of high school students even come close to meeting the guidelines for aerobic and muscle strengthening activity. Most of us fall short of the mark that reduces our risk of heart disease when it comes to exercise. Did you know that? So even for people who have no other risk factors, if you're not exercising, you're increasing your risk of developing high blood pressure, cholesterol problems, and diabetes. So we don't think about this, but that's how it creeps up on us insidiously, just sneaks up on us. And it's sad, but every once in a while I have this conversation, and it comes down to a close family member or a friend of a patient. It just happened yesterday. One of my patients was telling me, and this is a young person married to a young husband in their early 40s, a business owner, a devoted husband, father of a young child, and was rushed to the emergency room with high blood pressure, chest pains, anxiety, and she was just shaking her head there. And we're looking at each other like, how do we help this person? Because when it's not on your radar and you're not thinking about it and you're not doing anything about it, that's when it hits. That's when the rug gets yanked out from under you. And then if you're lucky enough to escape that and leave the hospital in one piece with your life intact, then oftentimes it's a wake-up call. And that was the first thing I said to her, we have the workshop coming up in a couple of weeks. And this is exactly what it's about. How to get your blood pressure under control, how to reduce your risk of heart attack, stroke, being rushed to the emergency room. How many of you know people like that may be like literally one day away or an hour away or one step away from that happening because they're too busy with life to focus on their health? We all know people like that. So, we don't know how healthy their heart is. Do you know how healthy your heart is? And what are the symptoms of an unhealthy heart? Besides high blood pressure and anxiety, but think about how you sleep. Are you getting a good night's sleep? Do you have sleep apnea? Are you constantly fatigued? Are you constantly tired? Like every day when you wake up, even if you sleep 8 hours, do you wake up not feeling rested? This could be due to a sleep disorder, and that's a high risk for heart disease. Feeling dizzy, lightheaded, short of breath, and irregular heartbeat. These are all signs of an unhealthy heart, or heartburn sometimes, stomach pain, inability to exercise as much as you used to, swollen feet. And these are many of the top signs and symptoms or warning signs of an unhealthy heart. And if you know anybody that has these things, whether it's you, your family members, loved ones, then you need to think about bringing them to the workshop, getting them connected with this, because up to 80% of heart disease and even premature heart attacks, sudden heart attacks, strokes can all be prevented. We have the tools and the knowledge to mitigate this, but we don't think about it until there it is. Boom, happens right in front of us. We're taking a family member or friend to the ER, and it's preventable. And that's the sad thing. Every 37 seconds, a life is lost to something like this, a preventable sickness and disease. So my question is, who are you bringing to the workshop? It's coming up in a couple of weeks, September 12th, Tuesday evening at 5:45. You'll get all the answers to this, as well as how to reduce your risk of heart disease by more than 80%, get better control of your blood pressure, cholesterol, how to reverse type 2 diabetes, and just learn a lot more about the most powerful nutritional strategies, heart healthy foods, and supplements that actually work. You'll learn all this and a whole lot more at our upcoming Heart Health Workshop. It's coming up again Tuesday, September 12th at 5:45. So make sure you call our office now. Reserve your seats, not just for you, but your family members, friends, loved ones, whatever, whoever the guests are. You're going to be a blessing to them. This is a life-saving event. Make no mistake. This is the workshop that saves lives. So don't miss out on the opportunity to be a blessing. I'm asking you, I'm begging you, please think about those you care for and get them registered now. Go ahead up to the front desk if you're in the office, put their names down while seating is available. If you're watching this at home, call the office, 954-472-6002. Thanks for watching today. I love and appreciate you. God bless.